Bradford, Sheffield. Now, here's an amazing story. Imagine waking up one morning and your child has changed personality overnight. This is what happened to Dawn Thomas Lewis from Rotherham. She got a 6-year-old called Evie. Now, Evie had scarlet fever back in 2019. And after that, she developed PANS pandas. Now, this is a disorder which can cause distressing behaviour, aggressive behaviour, violent behaviour, severe OCD behaviour, and, of course, tics. It's an incredible story, and it's one that she shared with our reporter, Jenny Els.
I'm Dawn. I'm mum to Evie, who's 6, and Evie's been quite ill over the last year. She had a complete personality change. I know the exact date, it was the 18th of January. Evie had done a couple of shows. She used to dance. She was in Rotherham Theatre, Civic Theatre. She was quite an outgoing little girl. She got up the next morning and she looked strange. Put it down to being tired. Went to get her dressed and she was screaming that her clothes were hurting her, wouldn't let us touch hers, snarling, spitting at us, kicking, punching. Evie had never been violent or anything like this in the past. Thought, oh, okay, tired, bad day, one of them things. But over the course of a week, her behaviour gradually went downhill. She started with some vocal tics, a grunt, a scream, and couldn't get her dressed, screaming she hated us, she hated herself. And as you can imagine, at 5 years old, we didn't know what to do. It was just so upsetting. You could tell she wasn't being a madam, as people might have thought she was being. She was physically in pain, and she looked different. The fear in her eyes was horrendous, the fear.
What did that make you feel like as a mum? Because, you know, you've known your daughter for 5 years, and suddenly she wakes up the next day and she's a different person, she's a different child to what you've known.
I sat and cried every morning trying to get her dressed. We went into school, asked if anything had gone off at school, like you would do, you know. Everything was fine, nothing had gone off at home. So at that point, we made an appointment to see a doctor. Took her into the doctors, and it was like a triage type doctor. And they said there was nothing they could do. She didn't have a clue. She went through safeguarding with us, asked us if we'd had anybody in the house, anybody had touched her. By this point, Evie's behaviour was just spiralling out of control. They then made us an appointment at Rotherham Hospital to see a paediatrician. It's an emergency appointment. Took her in, and that day she was wearing a pair of pants which belonged to her sister because she couldn't wear her own pants, a t-shirt and a pair of wellies. That's it in February. And the paediatrician said, well, she's dressed, can't see anything physically wrong with her, it looks mental health problem, CAMS. And I said, well, there's a 5-year waiting list for CAMS in our area. I can't wait 5 years to find out what's wrong with my daughter. And he says, my hands are tied, and sent us away.
So what then was the process? So you thought to yourself, right, what do I do now?
We tried to think back if anything had happened at home, and the only thing we could think was end of November, beginning of December, she'd had scarlet fever, been antibiotics for it, and after that she'd had a throat infection as well, and thrush in her mouth and everything from it. So she'd been quite poorly, but she'd seemed to recover. So we started looking at long-term health conditions, which could be tied into scarlet fever, throat infections, and we came across, it was an American article actually, on pandas, PANS, and from there we googled, and it was like, oh my god, this sounds like Evie. And from there we found the UK charity, and got in touch with them, looked what they offered, and from that the Facebook group, and we couldn't believe that there was other people out there. She wasn't autistic, and she hasn't got ADHD, because you just don't wake up with it. There was something which had caused this massive change in personality with her.
How did you go about getting a diagnosis? Because the NHS doesn't officially recognise pandas, does it?
In the UK, there are a couple of specialists. Unfortunately, you have to go private to see them. We were in the very lucky position that we had funds put away to be able to afford paying to go private. We are still going private, but money only lasts so long, and there's thousands of other people out there who haven't got the funds.
You mentioned there about the way that Evie changed. Is Evie herself aware?
Yeah, she knows. She'll say, I hate myself. And then afterwards she'll say, I'm sorry. At one point she was massively violent, kicking, punching. I've had scratches down my face, down my body, hitting the face, spat at. And once she comes out of it, you can see on her face, and I'm sorry, Mummy, I love you. And it's hard because that isn't Evie, that is the pandas. Her brain is telling her to do something that she can't control. I mean, she's 6 now, but it's still a very young age to be able to process what's happening to her. She does understand it. She doesn't know how to express it yet, but it's heartbreaking, to be honest with you, yeah.
It genuinely is. Vicky Burford is from the Pandas UK charity. Morning, Vicky.
Morning.
What a terrible thing to be going through, and it doesn't make it any easier, better, worse, whatever, but the fact that one night Evie was one thing and the next day was another thing, it must make it even tougher to suffer.
It's horrendous, actually, and what makes it even worse is the fact that this isn't just a one-off story, that this is happening all over the UK, all over the world, actually. But we're focusing at the moment on the patients in the UK, and we actually, in our support group, support over 3,000 families who have had this happen to them.
Now, the interesting thing is the difference between support and, of course, what would happen if the NHS actually recognised this as something that they could work at treating. Is there any kind of long-term treatment for it?
Identified very, very quickly. A simple course of antibiotics can make all the difference.
What, really?
Mm-hmm.
Even kind of post the actual disease that starts it, even if you're in Evie's situation?
Absolutely. I mean, in Evie's situation, she's been ill for a little while, so the treatment is probably, would need to be longer term treatment. But yeah, we really stress that the sooner you can get treatment for this condition, the better the outcome, for sure.
And the World Health Organization recognises it. Why don't the NHS?
That's a very, very good question, Toby. Very good question indeed. What I would say is that there are some NHS doctors who do recognise the conditions and do understand them, but there aren't many of them. And the organisation as a whole doesn't embrace the conditions. So what will happen is a child will present to their GP. The parent will say exactly as Dawn did, my child was fine yesterday, they woke up this morning, they're a completely different child. They're presenting with, obsessive compulsive behaviours or involuntary movements or sounds, or they stop eating. And then in that case, what would generally happen is that the GP would assume that this was a result of some sort of trauma or it was some kind of mental health condition, and the child would then be referred down the CAMS pathway. And we all know that as wonderful as CAMS are, they have a very long waiting list, and the treatment doesn't start straight away. In Dawn's case, she said it was 5 years.
Well, yeah, I mean, CAMS, the waiting list really around here, I don't know where you are, Vicky, the waiting list for CAMS around here are so long as to render them useless.
Yeah, exactly.
Because, I mean, the waiting list for Evie is as long as she's currently been alive.
Yes, precisely.
That's not acceptable, is it?
No, that's not good enough. And the trouble is, with PANS and PANDAS, it isn't a mental health illness. It's a physiological illness. It's an immune-mediated response to a simple everyday infection. So,
you see, that changes my next question, really, because I heard there that Evie had gone private, and I have some experience with this. I went private to get an ADHD diagnosis for myself,
right?
Because I was old, and the 4 years they wanted me to wait felt a long time.
Yeah.
So once I'd taken myself, and by going private, I don't mean I flew down there in a private jet and sipped champagne from an oyster shell. I mean, I spent 300 quid to see a doctor. But because I did that, I'm now totally removed from the NHS and can't get the ADHD medicine that the NHS would give me.
No.
But if this is simply a question, if you go private and then get diagnosed with antibiotics, you'd have thought that'd be quite easy.
You would, wouldn't you? But it isn't. It's not as easy as that, because as you say, very often when you've got a private diagnosis, it won't be accepted by an NHS practitioner. So what we find is that there's a real divide between parents who have got the funds to go privately and have their children diagnosed and treated, and have all the tests that they have to have, because PANS and PANDAS are both they're diagnoses of what's the word? I can't remember the word.
The symptoms are exactly the same as my daughter's, but that's a neurological condition. So I suppose what they've got to do is they've got to cross out ADHD and autism and all that kind of stuff
That's
first.
exactly what they have to do. Yeah, they have to rule out every other diagnosis that could cause these symptoms before they can diagnose PANS and PANDAS, because there isn't currently a blood test or something like that can identify them. There are tests that can point you in the right direction, but there's nothing sort of categorical that can rule it in or out. So it is a clinical diagnosis at this stage.
What kind of numbers are we talking, Vicky? How many young children are suffering from this?
Well, actually, because the conditions aren't recognised in the UK, it's difficult to identify in the UK exactly how many children have the conditions. But in the US, they estimate that there's 1 in 200 children suffer with the conditions to some extent. And, that's a huge number. And if that's the same over here, then, our 3,000 families that we support on the group is only the tip of the iceberg.
And that would also suggest that there are some children being treated for things that they haven't got. They may well be treated for ADHD, autism, global developmental delay, things like that, when in fact it might be PANS.
Yeah, we strongly believe a lot of children are misdiagnosed. And then we believe they're misdiagnosed actually with ASD and ADHD and OCD and Tourette syndrome and eating disorders. And many children are diagnosed with anxiety disorders. And actually we believe that if they were investigated for PANS and PANDAS and treated for it, that they may no longer have that diagnosis.
Oh, goodness me. Imagine if we've been missing something as big as that for so long. What a story that would be.
And imagine the amount of pressure that would be taken off CAMS if all of these children were actually treated quite simply with some antibiotics.
Goodness me, imagine that. Vicky, we're out of time. It's good to talk to you. Thank you very much indeed. Vicky Burford there from the PANS PANDAS UK charity. CAMS is the Children and Adolescent Mental Health Services. And the waiting list for a 6-year-old is 5 years. Where does that work?
Make a difference.